Don't punish the pain. It's becoming the rallying cry for patients with chronic pain.
People that for years and sometimes decades eased long-term pain with opioids without abusing the medications or becoming addicted. Now they say they're becoming collateral damage in the efforts to fix the opioid crisis in the state. They tell Two Works for You it's because of confusion over prescribing guidelines and new laws. Tommy Sturgis climbs in his car in Tonkawa, buckles up, and heads for Broken Arrow.
Every 30 days.
He says he has to make the long drive to find a clinic that specializes in treating chronic pain.
Rheumatoid arthritis, fibromyalgia, osteoarthritis, chronic back pain, now chronic neck pain.
On those long drives,
I tend to have a problem gripping too hard and it makes my joints hurt. When my hands are sore, it's just more comfortable.
Sturgis says for years his primary care doctors prescribed opiates for his pain, but not now. He claims confusion over Oklahoma laws limiting new opiate prescriptions and a lack of understanding of state and federal prescribing guidelines make it hard for chronic pain patients to find primary care physicians willing to treat them.
They've pretty much scared our primary care physicians into not treating pain.
There was a lack of understanding for some of those individuals, the providers, even the patients themselves, about what may have been perceived as punitive possibilities.
Dr. Kevin Taubman is past president of the Oklahoma State Medical Association. He says some primary care doctors fear they might become targets of state or federal investigations if they prescribe lots of opiates or doses that go higher than a certain amount. And doctors aren't the only medical professionals unsure of what can be prescribed, according to pain specialist Dr. William Yarborough.
An individual pharmacist and calls us and says, this is, quote, too much, and it's some chronically ill patient that's not even on a whole lot. They don't often even know what's wrong with the patient when they make that judgment.
Dr. Taubman says the Oklahoma State Medical Association is providing doctors with additional training to try and clear up confusion about new laws aimed at curbing opioid abuse and to understand prescribing guidelines do have exceptions to allow for treating chronic pain, so long as the patient is monitored for signs of addiction.
What I would like to see, though, is it eventually get back to where our primary care physicians that see us for every little thing can go back to treating us.